Okay, so today is your big day, and here are some tips to make sure that you have the best outcome possible. Now I'm going to do my job. You also have to do your best job. Now, what is your best job? First and foremost, you have to keep both eyes open at all times. Okay, so there's going to be like, sometimes I'll like cover one of your eyes with my hand so you don't cross fixate. If your eyes are narrow set, you could be looking at the laser light with the wrong eye. But anyway, no matter what I'm doing, you have to keep both eyes open. The reason is, if I try to close this eye is going to narrow a little bit, and you'll feel the speculum that's holding your eye. Your eye's going to be totally numb. We numb it with anesthesia drops, but we're not numbing the lid. So if you kind of close or blink, you're going to feel the speculum. It's going to be uncomfortable. Okay, so that's another reason you can't blink. If you blink, you'll feel a speculum. It also makes your eyes twitch. And then if I hold my eye open and I blink, I'll bells up. When I'm trying to blink, my eye's going to roll up. It's a protective Bell's reflex to protect your cornea if you can't blink. But we don't want your eye rolling up because you'll have a decentered laser ablation. You want the treatment to be right in the center of your eye. The other thing you have to make sure is not squeeze, not flinch, and just be relaxed. When I say to look at the light, I mean look at the red fixation light. If you're really good at fixating, it's going to change color, okay? The reason it's going to go kind of orange is your photoreceptors will actually desaturate, okay? So if you're doing a great job, the light's going to actually change color. And then sometimes I'll tell you to look at the bottom edge of the red light. It's because without glasses or contacts, you're going to see like a little blob. It's not going to be a point. It's going to be like a little tiny circle. So bottom edge really means the bottom edge of the blinking light, okay? And then I say eye up, eye down. That's eye up, eye down. If I want you to move your head, I'll say chin up or chin down. But if I say look up, I don't want you doing that. Okay, look up is that, chin up is that. That's pretty much it for that section. And just breathe normally. Don't hold your breath. The procedure is going to be between 10 seconds and a minute. But holding your breath is probably not the way to do it. So just breathe normally. It'll be fine. The laser's got a built-in tracker. It tracks at 60 hertz, which means 60 times a second. It's taking a digital picture of your eye and comparing it. And then if you're moving, it'll move a little bit. But the prescription and accuracy and the results visually are better if you don't move. It's better if you're like a dead person like this. So just be like a dead person, you'll be fine. Okay, so once we rotate you under the laser, you're not supposed to talk. The reason is there's a little bit of water when you're talking, like a vapor in your breath. So you don't want to be fogging up the mirrors of the laser. It might affect your prescription. There's a little metal shutter, but it's not like that watertight. So just don't talk when you're under the laser. Okay, if you're having our standard package, which is LASEK, I'm going to be holding a little alcohol well that's preventing the alcohol from spilling out. Your cornea is numb, okay? So as long as the well keeps the alcohol on your cornea, you don't feel it. Now, if you move or blink, it's going to leak and sting. It's not bad for you, but it will be uncomfortable and delay your recovery. Now, if we're doing the epi, the advanced quicker recovery thing, we're not going to use the alcohol. That's what makes it quicker. There's like a little suction device. You'll feel a little bit of suction. It won't be that bad, and that's pretty much it. And that one, you don't have to worry so much about blinking because there's no alcohol. You probably shouldn't blink too much because you'll be moving and it'll be harder for me to take the skin of your eye off. Now you have to keep your eyes closed for a few days afterwards. That makes the skin grow back as quickly as possible. Once the skin's grown back, your chance of infection is 0, so you really want to do that as quickly as possible. And then once it's smooth, then you'll be seeing 20/20. Until then, you'll be a little distorted actually, and then if the skin's not grown back at all, it'll be uncomfortable. So that's why you want to keep your eyes closed at all times until absolutely necessary. A week ago, I actually lasered my girlfriend, and she was not compliant. I saw her like doing like texting and like maybe watching a little bit of movies or videos. It's kind of dumb actually, because you're really just making the whole recovery take longer. So I had to kind of remind her 100 times, and it's really crazy. Okay, so just keep your eyes closed unless it's necessary. By necessary, I mean when you're walking or when you're doing work. Okay, but then we had like conversations where it's just like, oh, I have to have my eyes open when I'm eating. You don't need your eyes open when you're eating. You kind of know where your mouth is, you know where the food is. And I have a lot of patients who are super compliant, like Ben. He healed in 3 days because he did everything with his eyes closed. And a lot of patients say the food tastes better with your eyes closed because you're missing one of your senses, so the other senses are heightened. So just keep your eyes closed at all times unless absolutely necessary. If you're having one eye done, which is what she had done, you're really not supposed to do this either because you're squashing this eye and that pressure doesn't help the eye heal either, okay? So you're really supposed to have eyes closed as much as possible. I guess if you're doing one eye, you could cheat a little bit like this, but don't be like this whole time. And we don't like a patch with pressure because again, the pressure doesn't help the healing. that's pretty much it. And just keep your eyes closed as much as possible so you heal as quickly as possible.